people are going to look for this information on social media, whether you like it or not. Why not be a reliable resource of accurate information for them on these platforms rather than bury your head in the sand and be like, I'm not going to do that because I'm a physician and I shouldn't have to do social media. If that's the decision that you make for yourself, that's fine. But I think not understanding that this is where people are getting a lot of information is sort of missing the point, and
Yeah.
you are going to miss an opportunity to really educate the public on what your area of expertise is.
How did you find your way into men's health and wellness? And when did you realize this is my specialty?
I really didn't fall into men's sexual health and wellness until residency. So when I was a urology resident, we kind of rotate through the different subspecialties within urology. And I found men's health incredibly interesting and also felt like it was a way to really make a significant impact on the quality of life of our patients. During our training, we were exposed to, a lot of oncology, a lot of sort of terminal illnesses. And I saw a lot of those patients make it through the treatments for those conditions and those diseases and then sort of left to pick up the pieces. And I think men's health specialists a lot of times are there to help men recover from a lot of those treatments and continue to lead fulfilling lives after it.
What is the most common concern that you see in your practice?
The most common concern I see is probably erectile dysfunction. Yeah, it's a pretty common problem. It increases with age. It goes up about 10% with each decade of life. So 30% of men in their 30s, 40% of men in their 40s, and so on experience erectile dysfunction. So it's a problem that we see a lot in clinical practice. And it's my job to help people understand that if there's someone who is experiencing this, that they're definitely not alone. And it's actually a very common problem.
All right, I want to know what is one trend in this industry or just in men's health in general that genuinely excites you?
I would say I am increasingly interested in sort of two areas of men's health. I would say the first would be aesthetics. So we're starting to see a lot more men ask about and pursue treatments to enhance their performance, enhance the appearance of their penis. And so we do some of those treatments here. We do regenerative therapies to improve the overall function of the erectile tissue, things like shockwave treatment, radiofrequency treatment. And we do penile filler here to increase the size of the penis. All of these treatments that we offer in my practice, I only chose to bring them into the practice after doing a lot of research into these individual treatments, making sure that they were safe and were going to be effective for our patients, because there are lots of treatments out there that people probably read about that I wouldn't consider safe and effective. And so we've very carefully selected the ones that we offer here for that reason. And then I would say the other area of interest is sort of longevity kind of stuff that falls sort of outside of traditional sort of testosterone replacement therapy or other sort of traditional hormonal therapies that we provide patients. I live in Los Angeles, so I may be seeing a sort of skewed perspective, but there's like a growing interest in peptide therapies and what those treatments could add to the hormonal therapies that patients are already on. Unfortunately, there's not a lot of, large clinical trial data for us to make decisions on regarding these treatments. And it's a little bit of the wild, wild west out there. So we're just slowly starting to incorporate some of that into the practice. Again, looking for safety and efficacy data where available. And some of the data that I have looked at are pretty promising.
I'm curious, when you said aesthetics, it made me wonder. So are men primarily coming in for size enhancement, or is there other aesthetic components that maybe I don't know about?
Depending on the individual, you could probably find various areas to enhance cosmetically, but I would say the biggest one is increased penis size, right? So we use penile filler here. It's a similar type of filler that people use in their face and lips to add volume, and it primarily enhances girth, so it makes their
Mm.
penis thicker, not necessarily longer. But that girth enhancement translates to both flaccid and erect size. So they'll see a difference in both of those states. We have done treatments like scrotal Botox for some patients who have really tight scrotums. A lot of guys who are on testosterone replacement therapy for a long period of time can get testicular atrophy. So their testicle size shrinks and the skin around it shrinks with it. And so sometimes they'll have really tight scrotums or really retracted testes and it can be uncomfortable for them. And so sometimes we'll do scrotal Botox, which, you could consider a cosmetic treatment, but I would say most of the patients that we've done it for, I would say it's more of a functional treatment rather than
Oh,
purely cosmetic because they're having this really retracted state and it's uncomfortable for them.
I was about to say that sounds uncomfortable. Yeah.
Yeah. Yeah.
All right, I want to know if you could teach the world one key insight about this field, something
Mhm.
that really moves the needle, what would it be?
I could teach the world one thing about sexual health. I would say probably, and this seems pretty basic, but that there are real research-backed, safe, effective treatments for pretty much any sexual dysfunction that
Mm.
you might be experiencing, or at least you can find a provider who has had other patients with these conditions. And I think one of the hurdles sexual health providers that we run into is that a lot of patients don't know to seek help or are
Yeah.
ashamed of what they may be experiencing and think that no one else is experiencing it, when in fact, a lot of the issues that they may be dealing with are actually quite common. While we need to do a better job, I think, in medicine of studying sex and doing individual research around specific problems, we could always do better. There is a large body of literature looking at a lot of different sexual dysfunctions. And so if you're someone who's having a problem with, whether it be with an arousal or desire or pain, there are providers like myself who have experience with this and can help.
Yeah, absolutely. Yeah, we need to get rid of the shame so that
Exactly.
more people know that they can seek help and you don't just give up. You can still have a very satisfying life. Now, I want to talk to you for a minute about TikTok and social media.
Okay.
So, what is it like creating content to educate people? First of all, like, why do you do it? Why do you
Yeah.
think it's important? And just tell me about that experience.
So, I mean, I started my social media journey back in like 20, I want to say 2021, because it was still like the pandemic was still happening, I remember, but it was sort of not the beginning part. Yes, I think it was 2021. Kind of as like a just let's see what happens sort of thing. I thought it might be a way to kind of grow my practice. And it has helped a little bit with that. I think like patients definitely do say, oh, that they found me on, Instagram or TikTok.
Yeah.
That's not as common as you would think. I mean, also keep in mind that reach is well beyond the Los Angeles area or well beyond even California, right? Not everybody who sees me on social media is going to be able to be a patient here. But what I think it has done for me that I didn't really expect or have any, I didn't have the expectations going into it was that it sort of created me as sort of a thought leader in this space to
Yeah.
turn to get information about. One of the motivations to continue to do it is that people are going to look for this information on social media, whether you like it or not. Why not be a reliable resource of accurate information for them on these platforms rather than bury your head in the sand and be like, well, I'm not going to do that because I'm a physician and I shouldn't have to do social media. I
Yeah.
mean, if that's the decision that you make for yourself, that's fine. But I think not understanding that this is where people are getting a lot of information is sort of missing the point, and
Yeah.
you are going to miss an opportunity to really educate the public on what your area of expertise is.
Oh, absolutely. I could not agree more. That's something we found at Shaw. So we, educate therapists, educators, counselors, coaches. There's so much information out there from people who don't have the background to be giving this information, and it's
Totally.
misinformation. And people are going to be looking for the information, like you said, no matter what. And so we want to prepare professionals to be out there giving credible information about sexual health.
Yeah.
All right, now at Sexual Health Alliance, we train many people who are wanting to work in men's health. What's the most important thing professionals need to know about male sexual dysfunction?
That's a good question. I don't know. From a professional standpoint, I would say that men are unique in the sense that sometimes you have to work a little harder to get the information that you need to get from them to understand what's going on. I think culturally, women have had more contact with providers that sometimes talk about sex, right? Like most
Yeah.
women are starting to see a gynecologist in their teens, right?
Mhm.
And so they have those interactions very early on.
Yeah.
And not a lot of gynecologists are asking about sex, but some are. And so there's an open line of communication that has started for many women much younger or much earlier than it has with men. So men are not just not used to talking about these things. I
Yeah.
think that's an important thing to keep in mind. So you may have to work harder to get the same amount of information out to be able to help them. And secondly, I think, again, culturally, men really view as being like an integral part of how they identify as a man. They may be really reluctant to open up about their problem, especially if you're not asking about specifics. So if you're not asking them, you can't just sort of ask an open-ended question. I have
Yeah.
found that with my male patients, we really have to be specific. okay, how long have you had erectile dysfunction? If they say, oh, it's been a while, I say, no, no, no. Are we talking months or are we talking years? If they say
Yeah.
years, how many years, right? I want to know the context in which they're experiencing this issue because those details are important for me to like help them.
Yeah. Oh, that's such great advice. It's about asking the right questions,
Mhm.
specific questions.
Yeah.
If you could leave one message for the next generation about men's health, what would it be and why does it matter right now?
Oh, these are like such like philosophical
I
questions.
know. We go vet Shaw.
Future of medicine. But I could leave one message to the future generations. Probably would just say keep doing this work, right? Like I think that my generation of providers, we're the first on social media, right? We're expanding the conversation outside of the doctor's office. And I think that's been incredibly helpful for patients to get information, to seek help because they see it presented to them on their phone or, at home.
Yeah.
They feel more comfortable talking to a provider about it once they've sort of learned a little bit about it on their own through social media. But we still have a long way to go, right? We still have to do a ton more research and get even better data than we already have. And so I think that is really driven by patients, number one, but also by providers saying, like, we're not just going to accept how things have been done up until now, because clearly there's a lot of people that still have an unmet need and have been sort of left out of the necessary care that they deserve. We just got to keep pushing to prioritize sex as like a really integral part of overall health. We know that it's a microcosm of overall health. If we can help people talk about and address health issues as they come up, we can help people lead not only like more satisfying, better quality of life existences, but we can help them be a healthier person in general.
Amazing. Yep. Helping the world one provider at a time.
Yeah.